with the Mizan Tech University and the Mizan Tech University Teaching Hospital. They help us with our clinical programs. And we've also been lucky enough to work with the Rotary Club in Addis Ababa in directing funding for certain of our projects. So in the United States, we've been very fortunate to work with several organizations whose missions are compatible with our own, including Water Engineers for the Americas and Africa, or WEFTA. So WEFTA has contributed thorough subject matter expertise to clean water solutions for each healthcare facility in the region of Southwest Ethiopia, shown on the previous map. They've also devoted considerable time to ensuring the success of each water solution by traveling with us to Ethiopia and continuing to work with each healthcare facility. And lastly, most recently, we've collaborated with them to develop and deploy apps that are specifically targeted to collect data to help them inform our projects. We also partner with Aqua Research to explore chlorine production systems that can ensure that healthcare facilities have access not only to water, but to clean water. In Colorado, we partner with physicians with expertise in obstetrics and gynecology to help inform our clinical programs. And lastly, we're very grateful to have year-over-year support from several district and Oregon Rotary clubs, including Denver Southeast, 31, and so to best share the impact of these partnerships, it'll be helpful for me to give an overview of VHP's origins, as well as some of our current programs and insights into our values that drive to the success of our partnerships. So VHP was founded by Dr. Margaret Muldrow, who grew up in rural Ethiopia, where her father worked as a civil engineer and her mother worked as a educator. She returned to Ethiopia after having started her career as a physician in Colorado and witnessed a healthcare system that was not able to meet the needs of rural Ethiopia. So without access to clean, safe, and effective healthcare, she noticed that rural women suffered serious and sometimes life-threatening complications of pregnancy and childbirth. So fueled by her inspiration, her resolve, and persistence, Dr. Muldrow formed VillageHealthPartnership, and its mission is to prevent maternal and neonatal death in childbirth and to treat and prevent gynecologic complications of childbirth in rural. So our programs are currently focused in the West and Southwest regions of the country. In speaking about our partnerships, I'm talking mostly about the Southwest region, but in the West, we also partner with local stakeholders there and IRA Hospital to treat women with gynecologic complications of childbirth, fistula, or pelvic organ prolapse. And in the Southwest, VHP is collaborating with its partners to build a health system of care that will give pregnant women and neonates, as well as really all 700,000 residents of this area, access to safe and effective. In this area, we're targeting 7 health centers and 3 district hospitals, all of which refer into the regional hospital. So VHP and its Ethiopian and United States partners have collaborated with the health centers, district hospitals, and regional hospitals to create and maintain women's access to complete, safe, and effective maternal and neonatal health care. We built programs that are designed to make sure that each healthcare facility has the following necessary components to deliver that health care. So first off, access to adequate, reliable supplies of clean water and solar power. To this end, we partner with WEFTA, AEIT, and Aqua Research Inc. to ensure clean water access. WEFTA helps identify potential water solutions or well drilling locations. AEIT facilitate the drilling of those wells. And Aqua Research Inc. Ensures that the water, we're working with them to try and ensure that the water available is clean, which it hasn't always been in the past. For solar power, we partner with Sun Transfer Technologies, which I mentioned earlier, in order to acquire and install a solar power system currently into the Bachema District Hospital. This is hopefully have unreliable power. So another critical component to delivering maternal health care is access to healthcare professionals that have the skills and the equipment necessary to meet the needs of rural villages. So to reach this goal, we partner with the Nizam Tepe University Teaching Hospital, and their clinical professionals perform skill checks and do mentoring services for local nursing. And the last component that we work on is building infrastructure such as maternity waiting compounds to allow each healthcare facility to meet the healthcare needs of pregnant village women seeking safe childbirth services. And this, the EIP is our construction partner, and they built maternity waiting areas at local health clinics. So it's difficult to imagine, for example, how a healthcare facility can provide safe childbirth services if they do not have access to the water, if they have unreliable power and they're trying to deliver babies under the light of a cell phone. That's or if the nurse midwives don't have the clinical skills necessary to resuscitate. So there are several key attributes to VHP's approach to its partnerships that drive to successful collaboration. Some of those include inclusion. So VHP seeks to work with community stakeholders, healthcare facility leaders, and healthcare providers, as well as Ethiopian and U.S. partners at all phases of projects in order to gain broad perspectives. VHP's approach is also grassroots. So we do not present defined solutions for water or power to any of these healthcare facilities. Rather, we work with all partners to come to shared understandings of paths forward that each healthcare facility. Our inclusive and grassroots approach is successful because VHP, partly because VHP travels to Ethiopia annually in order to meet with partners face to face, to dialogue and understand how communities are evolving and how projects and process are moving.
Kate, a few sentences ago, you said something that caused me to think about does that imply you have a leadership role in the partnerships, or do you consider yourself as a project manager of sorts in leading the efforts of other organizations?
Interesting question. I don't know that I would say that. The goal is to be more flat in terms of how decisions are made. So we're genuinely taking the feedback and
So PHP considers itself to be nothing more than one of the partners, but with an eye towards how the system's working together. Survey, there's a breakdown.
Yes, I think that's a good way to say it, and I think that we're facilitating communication. A lot of individuals and organizations otherwise communicating and working towards this end goal. So yes, I think the latter way.
Would outcomes be more effective if someone took an overall view as opposed to the system just moving forward on its own?
I'm not sure.
I've been on that stage because I work on that since I happen to be part of the organization. The outcomes are very clearly defined in our strategic plan. Okay, led by the Village Health Partnership. the contributing partners having substantive play, as Kay says. The outcomes are very clearly defined year by year, out to 5 years.
If one portion of the system here breaks down, do you guys feel it's your responsibility to intervene?
Our partners on the site, on-site duty, okay, with our advisement. Okay, that's the way to think of it. Following Kay's lead, we're in an advisory position that way. Partners on the ground go there.
Okay, thank you.
Great question. So lastly, we have a one project at a time approach and working with those partners to define one project at a time, which helps them to define work that's possible and creates a beautiful for open dialogue on processes. So the ultimate impact of these partnerships is that our programs are informed by thorough subject matter expertise in both Ethiopia and the United States. We have enduring relationships with individuals and organizations who share their expertise freely. And individuals in Ethiopia and the United States are engaged, they have a high degree of trust, and they're willing to transparently tackle tough barriers together. The ultimate impact of these partnerships, as well as our programs, is a measurable improvement in the healthcare system that cares for village. Any other questions?
Well, I kind of like to follow up on the partnership idea. When before Village Health Partners went into the system, say that these entities that you're talking to here, but they just part of the operational system, or actually did they enter the picture? I mean, like the solar.
Right. That's a great question. That would go to like our partnerships historically. Speak to that at all.
You know, unfortunately, Roger, because you're sitting right behind Bob, I could not hear what you said.
Oh,
Not that I'm blaming Bob for this, but
okay.
Bob's a very good friend of mine.
So the partner entities, it's obvious that value is question, the previous question, is the system. So did these entities like the solar companies and the clean water systems and the local stakeholders in healthcare facilities, did they exist? They were in Ethiopia, they were kind of disconnected and just happened to be there.
Oh, I see what you're saying.
Or did the Village Health Partnership even bring them?
Aided by Mizan Hospital, the Village Health Partnership brought these together. Even our newest solar colleagues, which you say, Kay, who are quite new colleagues to our partnership team.
Were they in Ethiopia already, but just not working?
Some were already there in Ethiopia. AEID has a long-standing footprint in Ethiopia, but of course are key to our partnership. So VHP really, if I can humbly say so, thanks to Meg Baldwin's leadership, brought them together. They were disparate, including Rotarians in Adazawa, and was able to bring it into I'd like to say a cohesive package. Most of those were operative, but in disparate ways. And as Kay said, we're covering an area just the southwest of 700,000 people. They needed it.
Thanks.
Yeah, and I would say the local health clinics, we're certainly already working to that end. We have sources such as like the maternity waiting compounds, which is where stay before delivering, so that people in the community perhaps did not have as high degree of trust in them.
Has your partnership been able to travel to Ethiopia?
Yes, yeah. Actually, a few folks are in Ethiopia right now, and they went last fall as well. It's difficult. I know that the current trip was altered quite a bit because of conflict right now, but we do still go there and then are able to face to face with some of our partners who can travel to Addis Ababa. We're not able to travel to the rural areas.
Other comments or critiques for us for Kay?
How do they clean?
research is one of our partners, is actually the chlorine production. The chlorine, and we're actually working with them to have water.
That's the main one we've been featuring most recently. On a satellite and hub model, a hub and satellite model where we have a central production facility and then satellites taking the chlorine out, so to speak, to the key facilities. That's what we're working toward. It's not completely in place yet.
Is security an issue for water facilities?
Yeah, right. I know that's a really good question. I know I've read a little bit about in the past. Well, I've certainly conflicts. Somehow, but I'm not 100% clear on that. Well, it's sometimes less likely.
Receive my account. Right, one more time.
The healthcare system in the future. I'm not sure. Not that I'm try and stay very focused.
We have about 10 facilities we're working with currently. That's a lot.
Yeah.
Well, thanks, folks, for your questions and for your involvement. And Katie, thank you for your presentation.